My primary message to healthcare professionals is please get vaccinated. It's important to protect yourselves, to protect your family, but as important symbolically as healthcare providers to show confidence in the vaccine so that other people in this country follow suit and get vaccinated.
The U.S. federal government will determine the number of COVID-19 vaccines each state or jurisdiction will receive. The amount of vaccines sent to states will be based on the size of the state's 18 and older population. For more details on jurisdictional plans submitted to the CDC, search COVID-19 vaccination guidance on cdc.gov.
The federal government is coordinating the shipment of the vaccines and the vaccination supply kits to states.
Each vaccine is going to be handled a little bit differently. Some require ultra cold storage at -80 degrees, some just cold storage, and some will just require refrigeration. Most of the vaccines will be provided in a 2-dose series, and so you'll have to have the ability to store vaccine as well, and each manufacturer is providing information on how to do that.
COVID-19 vaccination providers should refer to the manufacturer information for detailed storage and handling information for each vaccine. To receive and administer COVID-19 vaccine and ancillary supplies, vaccination providers must enroll in the federal government COVID-19 vaccination program, coordinated through their jurisdiction's immunization program.
Healthcare providers will be required to sign and agree to the conditions outlined in the CDC COVID-19 Vaccination Program Provider Agreement.
CDC will make this agreement available to each jurisdiction's immunization program for use in conducting outreach and enrolling vaccination providers. Healthcare professionals should reach out to their state health department to enroll. CDC is developing educational and training materials for healthcare professionals related to COVID-19 vaccine storage, handling, and administration based on Advisory Committee on Immunization Practices recommendations, the ACIP General Best Practice Guidelines for Immunization, product information from vaccine manufacturers, and results of scientific studies.
It is a real privilege as a healthcare provider to be able to have this vaccine entrusted to us.
COVID-19 vaccination providers must document vaccine administration in their medical record systems within 24 hours of administration.
All COVID-19 vaccination providers must report COVID-19 vaccine inventory daily into Vaccine Finder.
In some jurisdictions, providers may report vaccine inventory to the jurisdiction's IIS for the jurisdiction to upload into Vaccine Finder. If you have questions about the process for your jurisdiction, please contact your jurisdiction's immunization program.
For more information on data and reporting, visit cdc.gov and search COVID-19 vaccine provider support.
It's important to know the COVID-19 vaccines are going to be available for free, whether or not you have health insurance, and especially in our communities for immigrants who are not able to purchase health insurance, they need to know that it's free.
Vaccine providers will be able to charge administrative fees for giving or administering the shot.
The provider then can get this fee reimbursed by the patient's public insurance, private insurance, or for uninsured patients, the Health Resources and Service Administration has a provider relief fund.
I think it's important that we look at this holistically. So the vaccine is important and it's a protective measure. Wearing a mask is important also. Physical distancing of 6 feet is important. Washing one's hands for 20 seconds is important.
Even after you've been vaccinated, it's super important that you continue to follow CDC guidelines and best practice.
The vaccine is a huge step forward, but it is not a silver bullet. And so after people receive the vaccine, we still need to do the simple things that we know work.
I'm very optimistic about what the ultimate impact of these vaccines will be. One, it will be important for the safety and the health of individual people. But when you get a certain percentage of the population vaccinated, we can create an umbrella of herd immunity literally over the entire country. That will take several months to occur, but I feel confident that if we get a substantial proportion of the population vaccinated, that we can actually end this epidemic as we know it in this country. For guidance and tools, please visit www.cdc.gov and search Toolkit for Healthcare Providers.